Hi, this is Dr. Daryl Daley, and this is Getting to Know Dr. Daley. So, I would think there are more similarities than differences. Daryl Daley is God-fearing. He loves his family. He loves to be sociable. He's easily accessible. He loves music. Dr. Daley tries to be accessible by his patients, tries to encourage that there's an international standard of care met, and just tries to be that good doctor that everybody likes. Why obstetrics and gynecology? Well, I think I was indirectly brainwashed. I'm from a household where both parents are doctors. My mother is a pediatrician, my father is an OB/GYN. So growing up, all I really saw was medicine, right? My father took me along everywhere to do his deliveries, to do his surgeries, to do his ward rounds. So he knew what he was doing. And I always saw how happy he was when he was doing what he was doing. So it kind of just transcended, and I wanted to emulate him. And I've emulated him, and I am now what I always wanted to be, which is an OB/GYN. No regrets. Why cosmetic gynecology? Well, if I wasn't doing obstetrics and gynecology, I believe I would be in the field of surgery or plastic surgery. So when I finished my training, I thought to myself the best thing to do, that would be a combination of plastics and surgery, would be cosmetic gynecology. A relatively new field, it's ever changing, it's ever developing. I'm always on top of the trends, and I just wanted to be a pioneer in Jamaica and the Caribbean in the field. Favorite genre of music? That is easy. Anybody who knows me, I'm a hip hop baby. I'm a rap 90s fan, from the Snoop Dogg's, the Tupacs, the Eazy-E's, and last but not least, my favorite rap group of all time, the Bone Thugs and Harmony. Rap for life. Well, when I'm at the gym, my trainer doesn't let me listen to music. He's more screaming at me and shouting at me and telling me to do the exercises. However, when I'm operating, it all depends on the mood I'm in, on the complexity of the surgery, and the mood the operating theatre staff is in, you know. I try to make everybody happy. So if it's a straightforward surgery, it's easy. We're in a festive mood, we're going to listen to some dancehall, we're going to listen to some hip-hop, right? If it's a more complicated surgery, we might do some jazz, we might do some classical music. And last but not least, if the patient is awake, I obviously give them the music they want to listen to. So they'll tell me what they want to hear, and they can get to listen to it. Well, because I'm a regular gynecologist and a cosmetic gynecologist, I'm going to have to answer this question two ways. For regular gynecology, I really enjoy performing myomectomies. I have a lot of experience with it. I've been doing it for many, many years. In Jamaica, it's our bread and butter. Every gynecologist performs a lot of myomectomies. So I enjoy doing them, and I enjoy what I do for the patient when I'm finished. In terms of cosmetic procedures, my favorite cosmetic procedure to perform is the O-shot. I have very good results. Patients love it, patient satisfaction is high, and I really try my best to empower a woman's sexual well-being. Alright, I love to travel. If anybody knows Daryl Daley, Dr. Daley, he's traveling every 6 to 8 weeks. But definitely the most interesting place I've ever been to was Dubai. Hands down, the culture, the cleanliness, the buildings, the architecture, the food, the deserts, the camels, everything was mind-blowing. If you haven't been there and you have the opportunity to go there, please check it out. I love Dubai. The most embarrassing moment. Alright, hear this story right now. Embarrassed about the story, but I have to let everybody know. So I'm a big Destra Garcia fan, was and still is. I went to medical school in Trinidad, and there was a big show in Valsane, and she was performing. At the time, I invited my brother, my friends, nobody wanted to go to the show. So I said, alright, me I go to the show, me want to meet Destra, me want my picture with Destra. So I went to the show early, mapped out the show, saw that the stage was right by the gully, and it was easy for me to go backstage. All I had to do was go behind the fence and I reach backstage, right? No problem. So waited for the right time, saw my opportunity, saw her backstage because I could see her through the fence, attempted to go behind the fence, and when I grabbed the fence collapsed and I rolled down the entire gully, 30 feet, party done. Oi, somebody rolled down the gully house, party done. Police have to come. Fireman come, get rope, come pull me out the gully. Did not meet Desha that night. So guys, if you know Desha, tag her, tell her I want to meet her, and tell her 17 years ago I rolled on the gully trying to meet her. What three important things would I recommend? One, women, get your well woman checkup. Choose one time of the year to visit your gynecologist. Whether it be beginning of the year or your birthday, have a full open conversation with your gynecologist, let them explore everything. Listen, ladies, there's nothing wrong with getting your nails done, your hair done, your lashes done, but we need to take focus on ourselves, on our inner being, and our health. Our health is wealth, right? So what we need to do is ensure that our health is priority, and the only way to know something is right or wrong is to visit a gynecologist. Many times I've diagnosed breast cancer and cervical cancer at the first visit that a woman has had, and she had to visit the gynecologist for 3 or 4 years prior. So please, please take it serious. Number 2, get vaccinated. HPV. Cervical cancer is the #1 cancer that kills women gynecologically in Jamaica, and is preventable. And many studies have shown that the vaccine can decrease the chance of you getting cancer. And last but not least, women, pay attention to what your body is saying. If you notice a lump, a bump, a discharge, abdominal pain, anything wrong, don't watch it. Head to your doctor immediately, get it checked out. It could be a sign of something very sinister, and let's deal with it.